discuss about the most trending topic in the world nowadays, that is COVID-19 pandemic. In other words, Corona pandemic. In this presentation, we give you a brief introduction to the topic, the disease origin and its spread and transmission of the virus. We also looked into symptoms and signs of it, how to diagnose and what are the treatment options. Finally, we will discuss about the prevention methods. Novel coronavirus is not a living organism. It contains a protein molecule and a RNA strand. This is covered by a layer of fat envelopes. Protein spikes of the virus gives it a shape of crown, and that is how this virus got its name, corona, because corona means crown. As we all know, the coronavirus was first found in Wuhan city, China. Community medicine specialists describe 4 stages of a pandemic. As the diagram illustrates, stage 1 means if the cases mostly imported from the affected countries or areas. If the local transmission from positive cases, we call it as stage 2. Stage 3 means if the disease spreads in the community, larger areas gets affected. If the disease takes a shape of an epidemic with no clear endpoint, as in Italy, we call it as stage 4. Transmission is mainly occurred via respiratory droplets as the other common respiratory pathogens. It is believed that the virus cannot travel more than 6 feet. The virus is absorbed by mucous membranes of the nose and the oral cavity. Then it undergoes genetic mutation and converts them into aggressive and multiple slaves. The diagram shows lifespan of the coronavirus on different surfaces. The virus can be released in respiratory droplets via coughing and sneezing and settle down on various surfaces. So as you can see, on the skin it can last for few minutes, and on clothing and masks it can last up to 12 hours. On wood, paper and glass metal, the virus can last for 4 to 5 days, and on plastic it will take 6 to 9 days. In certain conditions, the droplets can stay in the air for up to 45 minutes. Virus attachment to the mucous membrane, it follows the lock and key pattern. The spike protein S on the virus acts as the key, and the ACE2 protein on the surface of the host cells act as the lock. Patients with congestive heart failure, pulmonary or systemic hypertension. And also there is a relationship between a certain antihypertensive medications and acute respiratory distress syndrome and high mortality in this viral infection. This diagram demonstrates the entry and the attachment of the virus in the respiratory tract. The virus enters via the nasopharynx and attack to its membrane as it has more ACE2 receptors and starts to spread down in the respiratory tract. We point out the natural history of the infectious disease. The incubation period is roughly 5.2 days, and it can be range from 4.1 to 7 days. The longest time can be gone up to 12.5 days. The mean time from the exposure to symptoms was 5 to 6 days. Co-infection is very common with other respiratory bacteria and viruses, accounting for more than 50% of cases. Here are the main complaints of the infection. There are fever, sore throat, shortness of breath, cough, vomiting and diarrhea. And some people complain of loss of smell. From the Wuhan statistics, males have the highest preponderance for the infection. Most common symptom is fever, and 90% of people with infection get fever. And 76% of patients get cough, 44% of patients get myalgia and fatigue. Headache, sputum production, and diarrhea were less common symptoms. The clinical course was characterized by the development of shortness of breath in 55% of patients and lymphopenia in 66%. All the patients with pneumonia had abnormal lung imaging findings. CT chest sections illustrates different stages of lung consolidation affected by the virus. In figure 1 to 2, it shows patchy ground glass opacities, whereas in figure 6, you can see the complete consolidation of both lungs. We call it as lung. LDH and D-dimers also associate with the development of acute respiratory distress syndrome. The chest radiograph of right shows how the virus has affected the normal structure of the lungs. You can compare it with the normal chest X-ray of the left side. Shows distribution of COVID-19 infection. 80% of patients get mild symptoms. 15% of patients develop severe symptoms and 5% of them go into critical stage. Patients can shed virus 1 to 2 days before the symptoms appear, raising the concern for asymptomatic spread. And one good thing about COVID-19 is the lung fibrosis is less than that of severe acute respiratory syndrome or SARS, and patients has good long-term outcome. When considering the disease progression, 10 to 15% of mild to moderate disease can progress into severe disease, and 15 to 20% of severe cases can progress into critical cases. In USA, high mortality rates are seen in elderly population and less in younger age groups. The people with heart diseases get the worst results as virus cause myocarditis as well. And other high-risk groups are elderly people, the people with diabetes and lung diseases. Who are the clinically suspects? If a person with acute respiratory illness, with cough, shortness of breath, sore throat, with a history of fever at any point of time during the illnesses, returning from high-risk region or country within last 14 days. And also a person with acute respiratory illness and having been in close contact with confirmed or suspected COVID-19 case during the last 14 days prior to onset of symptoms. So, a person staying in an enclosed environment for more than 15 minutes we are defining as a close contact. If the patient with severe acute pneumonia, regardless of travel or contact history, also under this clinical suspect category. Severe acute pneumonia is defined as a patient with features of severe respiratory distress with respiratory rate more than 30 per minute and oxygen saturation less than 90%. This table illustrates the respiratory rates, heart rates, and oxygen saturation and level of care for different levels of severity. So, how do we diagnose COVID-19? Reverse transcription polymerase chain reaction is available for the diagnosis of COVID-19. Patient samples should transport in viral transport medium. Depending on the patient's severity, we can collect the swabs from nasopharynx or oropharynx, from mild cases, and endotracheal aspirate or bronchoalveolar lavage from severe cases, and also tissue biopsies from cadavers. False negative rates of COVID PCR even with 2 serial swabs was 10 to 30%. Next generation sequencing for COVID-19 was used as the gold standard. It is done by the PCR at day 3 and serology at day 7 from the onset of illness. PCR is better than antibody test considering the sensitivity. But PCR can give false negative results after 3rd week, so that antibody test is helpful in diagnosis after 3 weeks. Antibody test is also helpful to see the overall population prevalence in terms of how do we prevent contracting the virus? You should try to avoid close contacts with the sick people, and it is a must to wear proper PPE or personal protection equipment when contact with a sick person. Proper hand hygiene and wearing a mask is also mandatory. But the most important prevention method is staying home as much as possible. This diagram demonstrates the steps of proper hand washing. Hand sanitizers should have alcohol more than 65% so that it can dissolve the fat layer of the virus and destroy it. Also, you should not shake or touch various surfaces because the virus can lodge on different surfaces for various times of durations. If you shake, the virus molecules on the surfaces float in the air and be there for at least 3 hours and can enter your nasal passages. The virus molecules remain very stable in external cold or artificial as air conditioners in houses and cars. They also need moisture to stay stable, especially the darkness. Therefore, dry, warm and bright environments will degrade it faster. Ultraviolet light on any object that may contain it breaks down the virus protein. For example, to disinfect and reuse a mask is perfect. Be careful, it also breaks down collagen in the skin, eventually causing wrinkles and skin cancer. And the virus cannot go through the healthy skin. You have to wash your hands before and after touching mucosa, food, locks and knobs, switches or remote controls or any other things, and when using the bathroom especially. You have to humidify hands dry from so much washing them because the molecules can hide in the micro cracks. The thicker the moisturizer is, the better. Also keep your nails short so that the virus does not hide there. And heat melts fat. This is why it is so good to use water about 25 degrees Celsius for washing hands, clothes and everything. You can mix 1 part of bleach and 5 parts water directly dissolve the protein, break it down from the inside. You can use it as a home and washroom disinfectant agent. Do not use any bactericide because the virus is not a living organism like bacteria. In this slide, you can see different types of masks and their efficacy. N95 masks indeed filtered more than 99% of particles. Surgical masks lowered the number of aerosol droplets behind the mask still by a substantial fourfold compared to outside of the mask. As you can see, cloth masks and sponge masks do not filter the virus and not effective at all. The diagram explains why we should wear a mask in this pandemic. Droplets larger than aerosols, when exhaled, evaporate or fall to the ground less than 1.5 meters away. When expelled at high velocity through coughing or sneezing, especially large droplets can be carried by the jet more than 2 meters or 6 meters respectively away. So, always wear a surgical mask. This picture demonstrates the steps of wearing a proper personal protection equipment. So first, you have to put on special work clothes and work shoes. And you have to wash your hands using hand washing guidelines. Then you can put on a disposable surgical cap and put on medical protective mask like N95 mask. Then you can put on inner disposable gloves and put on your goggles and protective clothing. Then you can put on disposable latex gloves again. You have to follow these steps to remove your personal protection equipment. Replace the outer gloves with new ones and you have to wash your hands. Then remove protective clothing along with outer gloves. Then you have to remove your goggles followed by your mask. Then again you have to wash your hands. Then remove your cap. Finally, you can remove your inner disposable latex gloves. So during this each and every step you have to wash your hands according to guidelines. What is the impact on pregnancy? According to Wuhan data, pregnant women develop only the mild disease and no severe intubated cases were seen so far. And RCOG recommends strict precautions after 20 weeks of pregnancy for all healthcare workers. Okay, what are the treatment options available? Chemoprophylaxis is not recommended at present as currently there is no evidence of benefit. We strongly recommend 14 days quarantine for those who have significant exposure. And treatment is indicated for all patients with PCR confirmed COVID-19 regardless of the severity. Chloroquine and hydroxychloroquine are recommended if they are not contraindicated. And azithromycin is an option only in the presence of pneumonia if chloroquine and hydroxychloroquine are contraindicated. And also about treatment is not recommended for those aged less than 18 years and the existing data is limited and the disease severity is low. Treatment with ACE inhibitors like enalapril and captopril and angiotensin receptor blockers like losartan or telmisartan. So there is currently no evidence for discontinuation of these drugs with those confirmed COVID-19. Of 45 patients admitted in the last week of January. They took lopinavir and ritonavir for 14 days at a dosage of 400 milligrams, then 100 milligrams twice daily plus the inhaled interferon. Those who took Avigan cleared the virus in an average of 4 days